Hello and welcome to hashtag Our Doc Talk. We're talking COVID-19 and with us is NorthBay Healthcare's Chief Medical Officer, Seth Kaufman. Take it away, Dr. Kaufman.
Good morning, everybody. Happy Thursday. As always, we've been doing this every other week. I'm going to start with a few hot topics. Today is by far, you probably can expect it. We're going to talk today about the spike in cases locally and nationwide. And then we're going to talk a little about the holidays and how to stay safe, and then we'll go right into your questions. So thanks for joining us. So there is definitely a sustained rise in cases in Solano County, also in California, and of course in some states much worse than us across the country, across the world. What we're seeing here right now is while our risk level in Solano County remains right now in the red zone, really our numbers are in the purple. We did not revert back to purple, which I know would be devastating to some of our businesses and really has a very negative impact on our economy, and that has a health impact. It's also that these practices are safer when there's lower rates of COVID infection, and so it's very difficult to keep them open when rates are on the rise like this. So on that note, we are seeing about 12.5 currently, 12.5 new cases daily per 100,000. That's almost double the threshold for purple. That's our current levels. So we know the state in the next coming weeks is going to be looking at this. There's about a 2-week lag between the data and the state making decisions. And I know our county health officer and Solano Public Health is looking at the data, and as we try to just control this current spike, and at the same time try to support our community. So it's really hard, really hard. The day after election, just give you some examples. The day after the election, Solano County reported 114 new cases. That is a lot. That is a lot. As a comparison, our first big spike over the summer, our highest numbers there about mid-July was about 140. So we're not there yet, and I hope we won't make it there, but it is concerning. There's a lot of skepticism about positivity rates and case rates. If you want to see, but there isn't a lot of controversy about hospitalizations, right? If you're testing more or testing less, I guess that can play a little bit with how many cases you diagnose, right? Or how often people are positive. But hospitalization rates are hospitalization rates, right? If people get sick enough to be in the hospital, they go to the hospital, they get admitted to the hospital. Hospitalization rates are also way up. They're not at the level they were with the first spike midsummer, the big spike midsummer. As an example, earlier this week, pre-Veterans Day, when we have data for, we had 31 cases were reported across Solano County for hospitalizations. All this is available on the Solano County Public Health website. As a comparison, the peak of our last spike, midsummer, or mid-July, we had about 55 cases. So we're not there yet. And at the micro level, NorthBay has about those same numbers as a comparison. So we have our dedicated COVID unit, we have our dedicated ICU space, and we have numbers that are pretty similar to that. Our urgent care is also seeing a spike in numbers, so it is a real increase. This is not just a temporary one. Several weeks ago, the contact tracing, the investigations done by our hospital, done by every hospital system, healthcare system, and by our county, really pointed towards large gatherings as the trigger. A number of large gatherings, like really big ones, The current contact investigations for this continued sustained spike looks to be mostly attributed to smaller gatherings, with Halloween being the biggest concern, and we know that from across the country also. So, with that, a reminder that there are ways to stay safe as the holidays approach. Of course, the best way to stay safe is to just enjoy your bubble. So that's just your family that you're with every day. If you're able to have a bubble that's bigger than that, and everybody is very careful, that the best plan is to stay within your bubble, your household, whatever that bubble is. Remember, a bubble means those people are not seeing anyone else, right? Everyone's decided that these are people you have vetted and that are part of your inner circle, and it's sealed, right? That's the whole concept between a bubble. That's the whole concept with a bubble. For those of you that must go beyond that bubble. You're going to have a gathering of some kind, or you're going to attend another gathering, and it has to happen for your mental health, for other reasons. CDC has put out some Thanksgiving recommendations. There's a couple different sets of recommendations on the CDC website. There's overall holiday ones, and there's also dedicated Thanksgiving ones, and they're pretty good. Some are common sense, stuff you really know. Distancing, mask wearing, hand hygiene all over the place. Some are a little less intuitive, and I think they're really helpful. So one is absolutely no shared utensils. Don't have everybody grabbing the kind of spoons and the spatulas and stuff to get stuffing and things like that. You can do a couple things. You can have people bring their own food. You can obviously make plates in advance and things like that. If you have to, if somebody has to serve, maybe it could be one person, well vetted, wearing that mask, being good with hand hygiene, serving everybody, space everybody apart. All of that is about minimizing risk, and it's all about what has to happen, right? The safest is just being within your bubble. But if you have to, those are some ideas. Another one I found that was interesting is, remember, eating, singing, shouting, all those things spread this virus. And man, I love to eat. I love to eat at restaurants. So it's really hard for me. And I'm a loud talker. So all that's very difficult. One recommendation, a strong recommendation, is if you're going to have music on, you like to have music at your gatherings like this, have it really low so people don't have to talk loudly to hear each other. So that's a really good recommendation. It doesn't kill the ambiance and may keep people safer. So that's what's happening right now. It's really a scary time. It's humbling. It's real. No doubt about it. I will say, as one last hot topic that I meant to say earlier, was that it's definitive that mask wearing is beneficial. And I know that might be of course you know that, and I don't need to say that, but I'll just reiterate that for two reasons. A, there was a recent study coming out, and to me it was always intuitive, that not only does it keep you from spreading it to others, which I think has been a hard argument for some who are convinced they don't have it, so why do they have to wear a mask? But it also, which makes sense, keeps you from getting the virus, right? There's some studies out of UCSF showing that if, God forbid, you do get it, the severity will be less if you're wearing a mask, because not as much virus gets in your nose and your mouth. But also, it also protects you from not getting it, like you're wearing something over your nose and mouth. So a reminder that mask wearing, I know it, I'm disappointed that it's controversial. It remains controversial. I understand the argument around kind of that it's in some ways you're being forced, asked to do something that's sometimes uncomfortable for the public health good, but it's not just the public health good, it's protecting you yourself from getting the virus. So be really diligent about it. Do not get grandma or grandpa sick at Thanksgiving. That will not feel good. Remember, it takes weeks to really know who's sick and who's not sick. Just be really careful out there, and we'll all get through this together. I am feeling really hopeful that we are going to get control of this. I'm feeling pretty good. Okay, with that, Robin, what questions do we have out there?
Well, we have one question coming in from Kenny. He's saying, are there any risks with getting the flu shot other than, you could potentially get sick, he says.
Yes. So the flu, no, there's no risk to getting the flu shot other than local reactions, which if you've never had one before, you probably aren't going to get it. So it's the same, it's really the same vaccine it's been for a long time. So local reactions, and then this connection with people sometimes having mild symptoms, viral symptoms from it. There is, so no, there's no other risks. There's no connection between flu vaccine and COVID also. That comes up a lot because we push the flu vaccine so much. That's really because we don't want you to get any respiratory illness during this time. We want to keep everybody safe. We also want to keep our hospitals open for COVID, right? So we're really trying to keep our community safe from flu and from COVID, and we have a very effective flu vaccine, so why not get it? But no, there's no other concerns or risks. He's also asking, what are your thoughts on the upcoming potential vaccine for COVID? Oh, sure. I'm happy to answer that question. There was more news this week around has it been a week? Like that. Maybe. Around the COVID vaccine, Pfizer's vaccine in the middle of their global phase 3, almost done with their global phase 3 trial, showed 90% effectiveness. Somewhere around 46,000. I'm sorry if I'm wrong a little bit. Somewhere around mid 40 plus 1,000 people given the vaccine, no significant safety events, and they reported on the first 90 plus patients and had a 90% effective rate. Moderna also saying they're about done with their vaccine trial. It doesn't require the super cold freezer of the Pfizer trial, and they'll be submitting their data in days, supposedly, to the Data Safety Board, a wing of the NIAID. So the answer to that question is the reason is I imagine at our next session here, which actually will be after the holidays, and we'll talk about that. That we're going to spend a good amount of time during that first hot topic session talking about vaccines, because I still would say, I'm really hopeful, but I want to see what the independent bodies say. I want to look at the data, and that's what you want from your medical leaders, right? That's what you want from your leaders. You don't want to be reading a news story that you're also reading and saying, great, an effective vaccine. I want to see the data. But I am really hopeful. I am also I am trusting of our independent organizations, government organizations that will be looking at these and approving them to go to market. So the answer is very encouraged, but I'm reserved. Encouraged, but I want to see the rest of the data, and I think in the next 2 weeks we're going to get, documents that are available to you and I that are probably fairly detailed and maybe even a little difficult to interpret, but the summaries will be very helpful. I'll be looking at it, you'll be looking at it, and then we'll come back in a few weeks and really talk about it, but I think it's really encouraging.
That Pfizer vaccine requires super cold refrigeration. Are we set up in the event like we're going to get it and we're going to have the freezers we need? And
that's a good question. So the question is around the implementation phase of this vaccination program looks challenging. And we agree. Yes, so healthcare systems, CDPH, right? The California Department of Public Health sent out kind of surveys to healthcare systems saying, what do you have now? What do you need to be able to implement? Trying to be as proactive as they can in the event that we have an effective vaccine ready to go sooner than later, which we will. I feel confident we will. And so the answer is we will be ready. Those super cold freezers are not common. We don't need them for things in our hospital, our clinics. So, but we're setting up a system so we can easily turn that on and get it ready to go. So the answer is we're preparing for this. We have guidance from our public health colleagues, and I have zero concern that we won't be able to implement a vaccination program the minute we have the vaccine ready. But that is requiring, we're not waiting for it to be ready. We're preparing now in the event we have an effective vaccine.
You talked a little bit about preparing for Thanksgiving, and there's been some talk about having your Thanksgiving meal outside, which might require some space heaters, outdoor heaters. Have you heard of any concern with spread of COVID using outdoor heaters?
The question is have I heard of any concern about spreading COVID with outdoor heaters? No, I haven't. I don't think this is well vetted, but I haven't. I haven't seen one study showing any concern with outdoor heaters spreading COVID. Outdoors is for sure safer than being indoors. Some of those CDC recommendations, those Thanksgiving recommendations, holiday recommendations on their website talk about being outdoors. If you have to be indoors, having windows open. If you have patio heaters out, that's great. If you need a tent, having the tent flaps open, things like that. So no, I'm not aware of anything where if you're adding in patio heat, you're doing it outside and you're adding in patio heaters, that's increasing the risk of COVID or decreasing the risk of COVID. I'm not aware of any data on that.
Now, I had one person email me a question in advance. They have 3 sons in college. One of the sons at his college tested positive for COVID and is in a quarantine dorm. The others have not tested positive. And the question had to do with timing and how long to wait between tests in order to keep everybody safe if they come home for the holidays. So do you need another test? How long does he need to quarantine? That sort of thing.
So the question is, and with these very specific questions, I'm going to try to make it so it's applicable to the greater audience, and so I hope I answer your question, but I'm also going to kind of talk about the timeline of COVID. So the question is there's this person has 3 kids all in college. That sounds expensive and wonderful at the same time. And I have my 10 and 13-year-olds, so that sounds exciting, but I'm a little scared of the future. But so the question is one is positive in quarantine, the other two are not. How do I arrange this so I can have a safe visit with them and enjoy the time and keep everybody safe? I think that's the question. So let's just talk about the timeline of COVID and the testing strategies, and I'll try not to make this too long so we can get on to other questions. First and foremost, COVID is ravaging college campuses. Kids are back at school. They're in close quarters. I think compliance with PPE is tough. I'm not criticizing anyone, but that's not that. When we look at age and compliance, that population is less compliant than others. So we are seeing this. So anyone who's coming back from college, you should be very careful if they're coming in your house. So a few things. CDC has, for those without severe illness, which I assume if they're in quarantine in their dorm, they're not severely ill, the recommendation really is 10 days from symptom onset. 10 is really the most contagious period, and after 10 days, they're out of isolation. So that's number one. So really it's 10 days from symptom onset, but as long as they're fever-free for 24 hours, and I would even say symptom-free for 24 hours. Remember, mask wearing is really effective. So I like 10 days as a safe thing, assuming they get better in that time and they're doing well. Young people are bounced back pretty quickly from this illness on average, although we have some real sick young people here and there. And then, so that's number one. Number two, remember it takes a good 4 days, sometimes 5, which is longer than flu, from exposure to symptom onset. And when you get symptoms at that day 4 or 5, let's say you got it, you were most contagious for the 48 hours before that. So if I got exposed right now, I would feel fine for probably 4 days. Then I would probably start a little bit of a cough, maybe something else. There's really atypical symptoms out there, but let's just pretend I'm like the textbook case. I get a little cough, and I'm like, uh-oh, something doesn't feel right. It might even feel like flu because it all feels the same. I was most contagious the day before I had symptoms and the day before that. So 10 days for quarantine, I would be strict on that. Then when everybody comes home, if they have to, really it's not the safest thing to have everybody coming to your house who don't live there. That's like a guaranteed, honestly, I don't want to say guaranteed, but that's a very high risk way to get COVID. Mask wearing, mandatory around the house. Distancing, mandatory. Not eating together, mandatory. So I hope that answers your question a little bit. It's easy to say from my chair, like, not safe to come home, but of course, I understand you're trying to minimize risk and you just want to see your children, which I know is really important. So think with those rules, 10 days if they tested positive or symptom onset, as long as they're symptom-free at that 10-day mark, or if they were hospitalized, God forbid, then it's actually 20 days by CDC standards, and you should talk to your doctor about that. And then really think about really good prevention in the household if they have to be in the household, or can they just stay somewhere else and just have a lot of interactions in the backyard, that kind of stuff. Testing is great, so if you want to do some testing in the middle of that, tell everybody you got to quarantine for 10 or 14 days before you come, and I want you tested before you come. Most environments, right now it's getting tougher because of the spike, but a lot of areas have testing. So tell them to schedule a test as close to the visit as possible, and for, let's say it's going to happen 4 days before they visit you to give a few days for the test to come back. Really 6 days before that, longer if possible, but let's say 10 days before, a week before, they should really be extra diligent not to be opening their bubble up at all. Just be quarantining for the 10 to 14 days before, and then you get that test as close to the trip as possible. For your family member that's positive already, again, 10 days, and still there's a risk for transmission after that, especially if you're in your household. So, I don't know, you got to decide how badly he or she needs to be in the household. Okay. I'll stop there. I can go on forever about that stuff.
If you have COVID and you recover, do you have some immunity, and for how long? Or do they know yet?
If you have COVID and you recover, how long does that immunity last? I don't know that, and nobody does. But we have some ideas. So there was just a recent study showing that natural immunity waned in a good portion of people. And that was discouraging to our vaccine development. It wasn't as discouraging to the scientists and the virologists and everybody else, because artificial immunity, let's say with the 2 injections, maybe from this Pfizer vaccine, might boost things a little differently than your response to the natural infection. We also do know that if you barely had symptoms or it didn't affect you that much, that some people don't even get antibodies from that. But we're going to make sure you get antibodies if you're going to get a vaccine. So again, natural immunity and artificial immunity can be different. We would have been much happier if we learned that once you get it, antibodies last forever, or at least the amount of time that we're able to do this, which is like 9 months, a year, right? That's as long as this whole pandemic has lasted. So we coming up to a year, right? So that's as much data as we have. But we do see that with natural immunity, the antibodies are waning, but it doesn't mean the vaccine won't. And even if the vaccine antibodies do wane and drop off, if it lasts a year, it would really have an impact on this pandemic. If this became endemic, like the flu is, where we required a regular, just really never left us, you might have just like stopped breathing for a second, but it's possible. It doesn't mean we can't control it. So it might be that becomes part of our normal seasonal vaccines, and maybe it's even a combination vaccine. It doesn't mean you're getting a shot every 2 months of your life. So there's a lot of unknowns right now. We don't completely know. A temporary level of immunity would have an impact. My summary, by the way, is that whatever happens in the next month or two as hopefully an effective vaccine rolls out, whether it's 97% effective, or the independent bodies that review these vaccines say, oh, it's not 90, but it's 80 or 70, it's not going to change. Mask wearing, and we'll be in this transition period about what's safe behavior and not in terms of distancing. Eventually we got to hug our loved ones, right? So things will get better, but it's going to be very slow as we get to know the virus more and what the impact of the vaccine is. So as the months go on after a vaccine, there'll be tons of studies looking at antibodies, and we'll get a picture of who's getting sick and who's not getting sick. But it's not going to be, I got a vaccine or I got the illness and I'm going to rip off my mask and go to a party. It's just not going to be that way if you want to be safe and not get your loved ones or yourself sick.
What are your thoughts on youth sports coming back in 2021?
Youth sports coming back in 2021. What are my thoughts on that? My thoughts on that is that it could be done in a safe manner, and that education and physical activity for our youth is really important. And if we somehow got through this pandemic in a few months, then a few months of missing those kind of things is one thing. If this is turning into a multi-year impact. Doesn't mean we're going the whole next year. It doesn't mean I think things are going to get better. Again, I'm hopeful. I'm hopeful right now with the vaccination and other things that we're gonna really turn the corner and things are gonna start getting better as long as we all keep being really diligent. The answer is there's ways to keep it safe. There's ways to keep it safe. I'll tell you a personal story on that. My child is back playing softball. We're just not allowed to do. We've obviously had this approved. It's a formal league in my community, and but there's super strict rules around it, and so we can't play games because it's too much. That violate. It means it's touching, right? That's tagging and it's getting people out of the base. So we have things. We are doing drills. We're doing games that allow distancing. So there's ways to bring back youth sports without those interactions. It is most of the time outside, depending on which sport you're talking about. So that's helpful. There's a lot of positive things around it, but let's not sugarcoat what we're seeing out there in terms of children. You did use the word youth, I think. Yep, children. And that is that children are getting this disease. They're much less risk for getting severe illness, but they're definitely getting severe illness. We've had the biggest spike in pediatric cases in the last few months than we did at the beginning. I mean, unbelievable numbers. Like a third of all pediatric cases have been more, recent essentially. And that's because kids are going back to school. I'm sure it involves sports and things like that. So kids are still at much less risk. We have to balance the importance of them remaining interactive, and it's really important for their social development and keeping them safe. So I think there's ways to do it. I'm not like no youth sports. I think there's a way to do it. You have to be really methodical about how you're doing it with my softball example. And then I feel it's safe.
Okay. If you have other health issues, that you need taken care of, can you talk a little bit about not putting off your regular health care?
So the question is around, especially I think probably this question's coming up because we're in the middle of a spike right now, and we got this question a lot last spike too, is cases are going up. That means we're seeing it here in NorthBay Healthcare. Other systems are seeing it. Is it safe for me to go and have my other illnesses, my comorbidities, my illnesses checked in on? Should I be going to my doctor for visits? All systems, including ours, are doing a lot of video visits, which, by the way, should be permanent. Video visits are wonderful. If you don't need your lungs listened to that day, or your vitals checked that day, why not have a video visit? And many systems, including ours, have been doing them for a long time. So just putting it out there that certain things out of this pandemic are going to be permanent. Doesn't mean you can't go see your doctor, but video visits are wonderful ways to have a connection with your doctor, update him or her, but not have to get in your car, drive to a clinic, and all those things. With that, by the way, is we have all, NorthBay Healthcare has been diligent with this, and so is our healthcare partners in creating a safe environment for our patients to receive care. So we have not had a patient get COVID in our hospital or clinics. It's just not going to be the way you're going to get it. That's not how you get it. All right. So we are so diligent on our mask wearing, our hand hygiene, our distancing, rooming patients quickly, keeping them away from others who have COVID. If we're talking about the hospital or some of our areas where we do test for COVID. So the answer is it's completely safe, and you should be seeking, obviously making follow-up appointments, get that care you need. It's really important that you maintain your routine care. It is wintertime also. There's flu around, there's other viruses, there's a lot of things. You need to be as healthy as you can right now, as healthy as you can right now.
Can you talk a little about mental health and COVID-19? Are we seeing an increase in people seeking support due to being stuck indoors all the time?
Yeah, I don't have, the question is about mental health and COVID-19. And I have to be careful not to get on my soapbox about mental health resources because we only have a certain amount of time for this session. Yes, we are. I don't have data on me today, but we are absolutely seeing an increase in mental health needs, from anxiety to depression to other things, because of COVID. I think because of the instability in our country and the world. I think because of some of the isolation, quarantine, lockdown requirements that we need to keep ourselves safe. It's 100% happening, and I will get on my soapbox that there's not enough mental health resources out there, and it's not about the healthcare systems. We're doing everything we can, and so is our public health partners, so is everybody. But we need to continue to recognize the epidemic of behavioral health and mental health needs that have been here way before the pandemic hit us, and put some money where put some money into it and resources.
We're almost out of time. I want to tell those who have tuned in to join us later today at 12:30. We'll be with one of our oncologists, Dr. Jonathan Lopez, who's talking about how not all cancers are the same. That's going to be the topic of his discussion.
Dr. Lopez is wonderful. If you want to, wonderful. One of my favorites.
And then our next COVID chat will be December 10th.
Yep. So we will be back on December 10th. We are, it'll be actual Thanksgiving Day if we had our normal session. So we will not be around that day for this, and we'll see you on December 10th. And I do anticipate it'll be a really good discussion with more data, independent data from the companies that make these vaccines. It'll be a good vaccine talk. So please tune in. Thank you.
Thank you, Dr. Kaufman.